lead this closing session. And it's not a usual session as you've seen throughout the days. It's going to be a wrap-up of lessons learned, reflections. And from my point, I want to give a high level, very high bird's eye view of what have we discussed the past 2 days per session. So I'll give you a bit of an overview from that. Then we'll have two esteemed speakers addressing us. And Daniela will take the place of one of the planned speakers because she lost her voice and she went to the hospital. But we have a written word of reflection from her, so that will come after mine. So maybe also good to think back, like, why a company that focuses on Africa, health and business, a private for-profit advisory and consulting firm, which we are, would do an event focusing on the new public health order. Public-private, why would we do that? Well, because we believe public-private dialogue, public-private partnership is the key to move forward in a sustainable, lasting, and in a quality way. Partnership for us as AHB is at the core of everything we do. We always use the African proverb, which I'm sure you've heard of. If you want to go fast, go alone. If you want to go far, go together. And that is also the mantra that we as AHB really believe in. And I'm sure all of you know Amit. He's always at the forefront of these discussions, and that has a purpose. Not for us necessarily to grow our own business. That's a nice side effect, because you need to be sustainable in order to run a business, to employ people, to pay tax. But because we really believe in the value of partnerships, and we believe in the value of public sector, we believe in the value of the development space, and we believe in the value of the private sector. And that's why it's very deliberate that for this year's theme, we chose the role or the new public health order to really demystify the idea, to create awareness about it, and to spark discussions and to identify opportunities where public and private sector can collaborate together. So allow me to give a bit of an overview of the sessions that we have had since yesterday and give some key points on each of the sessions. So we started this first session identifying the role of regional institutions in this process. And the key outcomes from that discussion was facilitation. Regional institutions are focused on shared challenges and promoting shared objectives, and also to provide coordination of policies and best practices. We also always use the word enabling environment. If the enabling environment is there, given by stewards such as regional public institutions like in Africa CDC, but also by national governments, then the private sector can play its part. You need to have a level playing field in order to play the game. And I think that is a key ask from private sector towards public sector. Make sure that those rules, regulations are in place. And that links also to a session we had later where we discussed regulation should be an enabling factor and actually should make it easier for us to do business instead of being a disruptive factor that's costing us money, headaches, and limits us to actually scale. So that is one key point. Then we had 2 sessions on digital health, and that was on purpose. We broke in the health services part, and then we focused on data sharing and informatics. And it was actually interesting to see, because we've been doing these events since 2016, I believe, right? Digital health was a by-the-way thing when we started in 2016. It was a nice new innovation to now taking up almost 25% of our sessions during the 2 days and actually receiving most of the interest, which really shows that health sector is realizing the value and the potential that digital health has in this space. So the key points that we got from those sessions is mobile apps and digital solutions are very useful when it comes to adding value, both to the patient in terms of patient-centric apps and in terms of health worker and the services they provide in terms of quality care. When we look at the data sharing and informatics point, informed decision making is key. In order to do so, you need to have the right data. Digital health is an enabling factor in that. Instead of having all these paper-based systems with a wealth of information, let's move it to digital electronic health records, EMRs, and the likes, so that we can collect that information collectively and create AI systems, predictive analysis, but also to see where have we been and how should we move forward. And digital health is a key player and supporter in that. And who makes those innovations? It's the private sector. Who will use them? Private sector, yes, but who can benefit enormously from that? Public sector. So partnership in those is actually a non-negotiable. Then we had a session on partnerships focusing on disease prevention and care. main example that was mentioned by one of our founding partners of the Coalition for Women's Health in Africa, which is a coalition I'm very proud of, and I serve as the board secretary, which is the really practicing what we preach example of partnerships, where like-minded non-state actors are coming together. Even some are competitors, but all advocating, lobbying, and putting resources, literally putting money where the mouth is towards the common goal of creating an enabling environment for women's health in Africa, and serving as the one voice for women's health as a private sector for governments and regional institutions like WHO, Africa CDC, Global Funds, and the likes. For that coalition, we're still in the first year of starting operations, so to say, but we welcome anybody from your private sector to join. We believe it's a very powerful platform. It's not a product pushing coalition. It's actually a solution and like-minded coalition to really show that private sector is not only in it for quick bucks. No, we actually care about the women in Africa, and we want to see them progress and live longer and live healthier. AHB is proud to serve as secretariat and technical lead for the coalition. Another point that came up is that for human resources for health, training of health workers is very important. Enabling quality screening and providing access to diagnostics is key. And one panelist mentioned patients are actually our main partner. And it's good to keep that in mind. Often we work with health workers, we work with regulators, but who is actually the end recipient of our services? It's the patient. And keeping that in mind is key. One key point we also got from that session, and actually throughout, is you can not achieve that in silos. I think the session that was chaired or moderated by Ian mentioned you can walk in your lane but not work in silos. And I think that's the overall common denominator that has been passing throughout the conversations over the past 2 days. Another quote I wrote down because I found it very valuable is that disparaging the private sector is unfair when we, public sector, need their contribution to build health systems. And sometimes it feels like here we are preaching in church to the converted. And that's why I'm very happy that we're always able to get public sector decision makers in the room. And as I've heard all of them speak, they will deliver that message back home in the public sector and in the development space where often private sector is still viewed as being for-profit and money-driven and the likes, and demystifying that idea. For-profit is not bad. It doesn't mean for plunder. It means sustainability. It means job creation. It means tax income is coming into governments. That means that the Treasury has more money to give to the public health sector and public health facilities so that public sector is better able to deliver quality care to those who need it and who have very limited of non-ability to pay. So I think that is important to keep that in mind. Another session we did was on the human resources for health and the partnerships in that regard. Number I wrote down is that universal health coverage requires 4.45 health workers per 1,000 people. Africa is at the moment at 115 per 1,000 people, which is like 1/3 of what is actually required. What do we need? We need numbers to come up. We need a fair distribution of health workers also to rural and remote areas. We need to make sure quality care is provided by health workers. And in order for us to do that, they need to be motivated. This can be in monetary terms. It can also be in training. It can be in continuous learning and upskilling. And in this regard, also mentorship is key, which is something that came up in different sessions as well. Mentorship of the decision makers, mentorship of health workers, and actually private sector can add a lot of value in that process and work with governments and public institutions also to make that work. So another session we discussed the enabling environment for vaccines, therapeutics, and diagnostics. And it was mentioned there that since COVID-19, vaccines have been at the forefront of the discussions, and especially in the manufacturing discussions on the continent. But what about the essential medicines? Are we not forgetting that in the discussion? And should that not be the forefront of the discussion? Another point that was raised, we need to redefine what is local and what is regional. If you have a manufacturing plant in Uganda, it is considered local in Uganda, but not in Rwanda. How can you make sure that concessionary pricing is available to regional manufacturers? Is that local? Is that regional? Another part that was mentioned in that session is that regulators need to look at both quality and sustainability. And there needs to be more engagement between manufacturers and regulators in order to make that happen. And as I mentioned before, and mentioned in this session as well, regulation should be an enabler rather than a barrier. And an holistic approach in this regard in terms of manufacturing, but also distribution of medicines and vaccines and therapeutics is key. In order to get that, you need political will from the top level. If everybody keeps working in, the word comes back, silos, it will not happen. But if we start talking amongst ourselves as partnerships, which also means partnerships between public sector and governments on their own, then it is a possibility and it will be a reality. The last session we concluded was about disease surveillance and partnerships in that regard. What became very clear is that information needs to be linked to real-time decision-making, which is currently lacking. And the private sector can bring support here to governments to make sure that they have real-time insight on what's happening on the ground. In addition, private sector can share information about what is happening at their facilities, at their manufacturing plants and the likes. But in order for our private sector to share, you also need to create a trusting environment to make sure that private sector sees the value of sharing the information and also feels safe sharing that information. I think those are the main points that I've noted from the session. It's a very high-level wrap-up. We were going to do a fully-fledged conference report where we share a lot more details with you. But I think overall, I think the quote, let's work in your lane, but let's work not, or let's walk in your lane, but let's work not in silos, and let's do partnerships, which is at the core. So if you look at the role of private sector in Africa's new public health order, to answer that question, what is the role of partnerships? And it is already a pillar in the new public health order. So that makes me very happy, because that makes me realize Africa CDC also realizes that you cannot walk the talk alone. And to walk towards action, you need to do it together. And I think that is what we at AHB are really at the forefront, to make sure that the awareness is there, the insights are there, and the convening and catalyzing power is there as AHB. And yeah, it's been my pleasure. And I think if I speak on behalf of the whole team, it's been our pride also to host you here and to make those discussions possible. Before I close it, I want to, or actually Daniela closes the session, we still have two eminent speakers that we would like to bring on stage. As I mentioned, we were to have Honorable Catherine Mwangi, the High Commissioner of the Embassy of Kenya here. Unfortunately, she lost her voice. She went to the hospital, but she left us with some words of wisdom, and I believe Daniela will read them on her behalf. So Daniela, welcome.
Okay, thanks, Maluz. So this is a speech from Her Excellency, Dr. Mrs. Catherine Muigai Mwangi. She's the Ambassador, Extraordinary and Plenipotentiary and High Commissioner of Kenya to South Africa. I can assure you I have never read a speech for somebody with such an important title. Yes. Excellencies, ladies and gentlemen, let me begin by extending my deep appreciation to the organizers of this event for inviting me to discuss key lessons learned during this Africa Health Business Symposium of 2023. I'm particularly honored to speak to a distinguished audience with ministers, business leaders, health practitioners, civil society, and many other relevant stakeholders, all of us united in one agenda of promoting public health in Africa. This event has accorded us an important forum to have a conversation on the critical role of the private sector in the implementation of Africa's new public health order. Ladies and gentlemen, while the unprecedented COVID-19 pandemic left us with many painful scars, it also taught us valuable lessons. The pandemic exposed the fragile nature of our healthcare systems, but most importantly, the need for self-sufficiency. I therefore laud the African Union Commission and the Africa Centers for Disease Control and Prevention, Africa CDC, for the new Public Health Order for Africa, an initiative which offers insights and a roadmap for sustainable health outcomes and health security on the continent. I similarly commend the Africa Health Business for their strong commitment to the health system strengthening agenda of by continuously organizing this conference to champion the discourse on the role of private sector in this regard. This symposium has deliberated and reconfirmed that the private sector indeed is a critical stakeholder in the implementation of the 5 pillars of the very important new public health order for Africa. Indeed, AHB, the consulting firm that has convened this meeting, is a testament that there is a lot the private sector can contribute to addressing healthcare in Africa. Ladies and gentlemen, allow me to now focus on the specific lessons learned in this regard. During the first session on the role of regional institutions as stewards for continental unity in the new public health order, the message that came out was that the private sector remains a key partner in the promotion of continental unity for the strengthening of health systems in Africa. The symposium also focused on the role of digital solutions in health to advance the new public health order. This session delved into the use of digital technology and how digital health solutions have revolutionized healthcare delivery and services. Ladies and gentlemen, digital health also includes data sharing and informatics. Sharing health data is vital as it can contribute to the enhancement of quality of processes, the outcomes of health services, and the continuity of care for patients. It may also lead to the building of a knowledge base which should be able to interact with other data systems, including, for example, data on social determinants of health and registry. The secondary use of health data is important to improve the quality of healthcare and research effectiveness. The 5th pillar of the new public health order calls for respectful, action-oriented partnerships to increase domestic investments in health, to advance manufacturing of health products, to develop the health workforce, and strengthen public health institutions in Africa. Ladies and gentlemen, the importance of health partnerships cannot be overemphasized. These partnerships should, however, also be geared at promoting an enabling environment for all health systems in all the countries of Africa. Health systems can not only function with adequately trained health workers. The health workforce is a key component for advancing the new public health order. The World Health Organization estimates a global deficit of about 12.9 million skilled health professionals, that is midwives, nurses, and physicians, by 2035. And the lessons learned are that there is need to leverage on partnerships to bridge the healthcare workforce gap through recruitment, training, and retention, and ensuring diversity and equitable distribution of skilled professionals. Ladies and gentlemen, as I conclude, I wish to reiterate a message that has been echoed so clearly throughout the various submissions by experts and stakeholders in the healthcare sector, that the private sector indeed remains an important actor for the realization of the new public health agenda. Indeed, as societies urbanize, their populations have become increasingly dependent on the private sector for essential services. I therefore take this opportunity to urge all stakeholders to continue working together towards achieving public health goals of Africa. I thank you. Okay. I'm back as Daniela. Dr. Prof. Jean-Jacques Muyembe, are you in the room? Okay, not yet. So I will proceed to give a vote of thanks. Just give me a minute. I wish to thank the entity that made this conference possible by lending us their theme and supporting us to invite all of you to talk about public health in Africa. And that's the Africa CDC. Dr. Nikes Ndembi, give them a clap. He just got a call. We will ask him to pass our gratitude to His Excellency Dr. Jean Kaseya, the new Director General for the now independent Africa CDC. I also wish to thank representatives of ministries of health from around Africa that have been present at this conference. Honorable Anifa from Uganda, we are so thankful. We're used to ministers just attending the opening, but I've seen you coming in and out across many sessions. Thank you very much. And I know you had several people with you from Uganda. Thank you for whipping them to come to our conference. I'll mention them. Honorable Cicely Kariuki, former Minister for Health Kenya. We're so thankful that you're here. Please do not quit the health sector. It still needs lessons of leadership that you so aptly presented in your panels. I also see Dr. Okware, the Director of Health Services Uganda. Thank you so much. Dr. Patrick Luwaga, I think he stepped out. Is it? Oh, there you are. Thank you. The Chairman of Uganda Healthcare Federation. Actually, we serve with him in the East Africa Healthcare Federation Board. And I think people have left. Thank you very much for attending our session. I see representatives of many different countries. I don't dare to list all of them because I'll forget one or two. But we even have Dr. Jean-Jacques Muyembe from DRC, who's just stepped out. He was in the previous session. We have Dr. Kingsley Oidabara from Ministry of Health, Nigeria. At the back, we have Dr. Jelita Chinyonga, who is Director of Performance Improvement, Ministry of Health, Zambia. MOH Amit, I'm trying to look in the crowd. Have I missed anybody? We have the CEO of the Africa Public Health Foundation, Dr. Ebere Okereke. Thank you very much. These are the people who've really colored our discussions, of course, alongside very distinguished ladies and gentlemen from the private sector. Yes, let's give non-state actors, let's give ourselves a clap. And I'd like to thank all the speakers and moderators for such insightful. I was the MC and I was taking notes, but I was really enjoying as if I was a participant. And I hope I will give your insights, justice as I try and summarize this event into a report. I would like to thank our MOU partners. These are organizations with whom we've got into organizational partnerships for work that extends beyond this conference. I'd like to recognize African Global Health from Morocco, if they're here. They're not here. We have also got into a partnership with the European Connected Health Alliance. Brian O'Connor, if you're here, thank you very much. We applaud you. Thank you for flying all the way with your colleague from ECH Alliance to moderate our sessions and to announce our partnership. 3Analytics is an organization about pharmacovigilance, so important as we start to manufacture vaccines, therapeutics, and diagnostics on the continent. And we have got into a partnership with them. Professor Sunitha, if you're here, please wave. Thank you. She's come all the way from India to sign the partnership. We're very thankful. The Pan-African Health Information Network has been launched by Africa CDC, and it was announced here for the first time as a network. It was a sort of soft launch, and it was represented by Mr. Cyril Sek. If you're here, thank you very much. He has stepped out. The Global Fund were not here, but Africa Health Business has got into a partnership with the Global Fund to increase the lives saved from HIV, TB, and malaria through private sector engagement. So let's give a clap to the Global Fund. I also want to applaud the United States Pharmacopoeia in Africa, CDC, who have also got into an organizational MOU that is geared towards health workforce development and quality medicines. Then I wish to thank our event partners, our sponsors USP, Roche, Lecturio, PharmAccess, MSD, Broadridge Group, B Medical Systems, GE Healthcare, and Sanofi. Let's give them a clap. Our strategic partners, Global Health Strategies, Access Health. Let me run through all of them first. Moan Events, ECH Alliance, Africa.com, German Health Alliance, the African Society for Laboratory Medicine, the Consilient Group, SALDA, the USA Healthcare Alliance, PRA Consultancy, the Coalition for Blood in Africa, KZN-DHC, SAMED, African Global Health, Board of Healthcare Funders, Organon, International Health Insurance Forum, and the Coalition for Women's Health in Africa. Let's give them a hand. I would like to thank Hilton Hotel for giving us a beautiful meeting venue with many, many rooms where we could have our little meetings on the side, and for giving us good food. We are still standing. We have no stomach issues. So we are thankful. I don't see a hotel representative here, but Safia Variawa coordinated all this, and I'm very thankful. And then I would like to thank my co-MC, Mr. Masimba Marevera. Please stand up. Thank you very much. Masimba is a very accomplished actuary. Where I come, my mother tongue, we don't know the difference between R and L. So you're lucky I'm not calling you an actually. So thank you very much, Masimba. I really enjoyed co-emceeing with you. You added flavor to the event. I would like to thank Ilosi Event Company. As you were coming in, were you greeted by very well-dressed ladies with a smile at the registration desk? And perhaps you thought you were boarding for a flight. They were so well-dressed. Please come in front. We'd like to clap for you. Ilosi Events Company, thank you very much. These young ladies made us feel very important. Thank you. Even if you've had a hard day and you're having meetings in between sessions on Zoom and you meet that smile, you just decompress. Thank you. Now, I would like to call on stage a very important group of people for us to recognize, and these are all my colleagues at Africa Health Business. We are a small and medium enterprise. We're very small. We're 28 staff. 50% of us are in South Africa right now doing this event. So I'd like to call my 13 colleagues to come on stage. I want you to see them. Please come. I don't know who will take our photograph because I want the photographer to come. Yeah, please come here. We have a volunteer to take our photo. Thank you very much. Okay, Dr. Thaka is our able leader. Please come on stage. And it's been amazing planning this event. Believe me, my job is just to talk. So anything else that wasn't talking was accomplished by this great team under the leadership of our MD, Maluski Bacha, and our very executive chairman, Dr. Amit Thaka. Yeah, so thank you, team. Let's take a bow. We've pulled it off.
Keep it up.
Thank you.
Thank you.
Thank you very much, team. So thank you for taking care of us, South Africa, because had anything happened, half our company would not exist. Thank you, guys. I'd like to thank our audiovisual partners, the company that did all our audiovisual, made sure the mics are working. They're called Upstage Events. Where are you? Please wave. Those are the technical guys there. Thank you. If you want to have an event, I think their equipment works very well. They're called Upstage. I would like to thank you, our participants. Let's give everybody here a clap. You've been such a good audience. You have asked questions, you've made the panelists sweat, and yes, there were so many questions. Even in the side sessions, the participation was on another level. And we would like to welcome you all to a well-deserved cocktail, courtesy of our partner, African Global Health, where they'll ensure that you enjoy some Moroccan hospitality. And this will be at the ballroom foyer, just outside here, from 7 p.m., where you can drink your fatigue away and try and learn a Moroccan word or two, courtesy of our hosts. So I'm really thankful to have you here for 2 days. You're all seafood people that have taken time away from your busy schedules. Thank you very much. God bless you.
Thank you, Daniela. Good evening. Just one last thing before we go. Professor Muyembe, please come forward. Give a round to Professor Muyembe. Again, I want to extend my thank you to each one of you. One particular takeaway message is, for the first time, you've been a witness to the third focused engagement to make healthcare really strong in Africa. We've done 3 things. And I want to mention the 3 things. You can see the logos that Daniela presented. The first one we did is we created a public-private model of engaging in blood, strengthening blood systems. So I invite you. You don't need to be a paid member. You just need to be a person who wants to increase and strengthen blood systems in Africa. One particular focus we have in the blood system is sickle cell disease. Sysmex, who are here, many of you who are in diagnostics, and many of you who are in therapeutics are going to make a difference in lives of people. The logo that you see there is the Coalition for Blood in Africa. You want to be part of it? Join us. You want to make a difference of people in Africa with blood? Join us. So we are extending our first focused healthcare group discussion called COBA. It's on the way. We launched it during COVID. You heard from Organon earlier about the newly formed focus on women's health. Many of you have been part of us last year when we discussed women's health in Africa. The statistics are staggering. The challenge is huge, but the partnership is marvelous. Public and private sector have decided to come together and form an interesting coalition called COHA, which you see the logo right there, to make a difference. This is another call for action. This is another call to you. You can become members. You don't have to be paid members. You can even become strategic partners. And today, we did have a deep discussion to bring our newest partner on board, UNFPA. So thank you, UNFPA, for joining. Is Jyoti here? They will come in and then we've got, of course, our chair for Coalition of Women Health Alliance. And I'd like her to stand up so you can see our chairperson for Women's Health in Africa. Guess who it is? Mohari is right here. Misheshe is right here. So she actually holds women's health right in the forefront of partnerships. Please see her if you can. Today, we've also managed to create digital health as a platform under which Africa CDC will be leading the whole process of the 15 flagship initiatives that Cyril showed to you here through a model of private and public sector engagement. We've got development partners, we've got foundations, and there is now an open call for you to join PAHIN. PAHIN is the Pan-African Health Informatics Network. Next year, we are going to show you the results of PAHIN. PAHIN will do partner-to-partner engagement. PAHIN will also do innovations, and PAHIN will work with governments through the coordinated approach by Africa CDC, so we implement the right product at the right time with the right process in place, because digital health is great, like Malu said. We just started a few years ago, just talking about it. Now it's become a real pillar, but it's very confusing. And so to enable us unentangle this model, please, I ask you to join PAHIN if you want to. I just want to finally bring Daniela back on stage to show you what we are going to do next year for 2024. And it's going to be an open call for our planned series of engagement. And I really wish that you can join us. After that, I'd like all the opening panel ceremony speakers who are already here. I can see Dr. Jelita, Honorable Anifa, Honorable Karyuki. I can also see Nikes. Who else is meeting? I know Janet is not here. I think we don't have Auda Nepad, but we will represent her so she can officially hold a shield of our next partnership series. So thank you so much for your time.
Thank you, Amit. I'll tell you about Africa Health Business Symposium series for 2024 as Professor Jean-Jacques Muyembe prepares his closing remarks before we call the opening ceremony. Next year, okay. I'll call Professor Jean-Jacques to close before the opening ceremony speakers come up. We're starting over. So we think that having this once a year does not do justice to the new public health order and private sector participation. And so we've decided to have a series of 4 symposia in each of these 4 regions that you see on your screen. So we want to be in East and Central Africa in Q1, in Southern Africa in Q2, in North Africa in Q3, and West Africa in Q4. In this thought leadership series, to implement action by private sector for Africa's new public health order, we are going to have high-level policy discussions and workshops. This includes the policy makers to start us off and set the stage, and then the technical level people to thrash out the details of actual implementation plans of achieving the new public health order. And we are targeting 60 to 80 people, participants from public and private sectors, NGOs, and development partners to be part of these workshops, and that key outputs will be published as implementable recommendations to move from talk to action. And the agenda will be co-curated with a lead partner. If you want to be a lead partner for this series or for any of the regions, please get in touch with us. You can co-curate with us the topic and the approach. And then we shall be free to invite series partners who will contribute to that topic. So that's where we're going to be in 2024. If I can have this shield. Yes. So every time that we have a Africa Health Business Symposium, we put a stamp on this board. Yeah, thank you, Masimba. So this says Africa Health Business Symposium was held in Nairobi, Kenya in 2016, in Dakar, Senegal in 2017, in Johannesburg, South Africa in 2018, in Addis Ababa, Ethiopia in 2019, in Casablanca, Morocco in 2020, and then we were locked in by COVID, so we had a webinar series in 2021, and then in 2022 we had 2 events as part of one series. So we had in February 2022 Africa Women's Health, and in November 2022 Africa Men's Health as our 7th edition. The men are happy. But it was not well attended compared to the women's. So we don't know whether we'll do it again. The women's one was oversubscribed, and the men's one we were really struggling to get participants. And then 2023 stamp is already here, Johannesburg, South Africa. And so thank you so much, Masimba. So we will add 2024 to that at the end of next year. I now wish to call Professor Jean-Jacques Muyembe to give closing remarks, and then Amit, you can call the VIP guests up on stage.
Okay, just to say that I am 81-year-old. And I never attend this kind of meeting. What I feel is that Africa is now on the way to have a good system, a health good system, and that is very important. In my life, what I did is to give the education, medical education, to train people. And when I visited Kenya, I went to Kemeri, I went to Nogushi in Ghana. It was fantastic. And my dream was to do the same in my country. And when I started at the Institut National de Recherche Biomédicale in DRC, I was the only one PhD. Now we are 27. So this is very, very important. It must be our objective to improve the health system in our countries in Africa. And the national leadership is very important. And also what we need is a good partnership. Please, we need technology. We need also a good management. So thank you very much. I learned a lot when I came here. I am virologist, but now I know more or less everything in the field of medicine. Thank you. Et bonne chance à AHB. Merci beaucoup.
Thank you, Professor. I think we will continue inviting you. You don't look 81. Does he look 81? Let's give him a round of applause. So, next time at Men's Health, we will be calling Professor to tell us, some of us who remain sedentary, why we should not remain sedentary. You know, so exercise and doing what he does with passion keeps him young. I really want to congratulate him because he was really the co-scientist in founding Ebola, and that's really an honor for us to have you with us. Through your efforts, you've really, really done a lot and saved so many lives. So, like our official tradition, I'd like to invite our VIP guests who are with me at the opening ceremony. If Nikesh can join me upstage, Dr. Nikesh Dembi, we want to now endorse and officially hand over to our next Thought Leadership Series. Honorable Anifa Kahuya, please join me. Honorable Cicely Kariuki, please come up on stage. Can I invite Malus Kibacha to join up? And Daniela as well to come with the plaque. And we can take an official photograph, which I would like you all to witness and be part of when some of you will be joining us for the Thought Leadership Series next year.